Perform hand hygiene and ensure privacy. Introduce yourself to the patient and then identify him using 2 identifiers.
I'm Nikki. I'm the nurse taking care of you today.
Nice to meet you.
All right. Can you tell me your name and date of birth while I check your ID here?
Todd Davis, 8445.
Okay.
To prepare insulin for administration, first check the healthcare provider's orders. Determine the patient's blood glucose level and when his next meal will be. The usual interval between injecting rapid-acting insulin and eating a meal should be no more than 5 to 15 minutes. Different kinds of insulin have different times of onset, peak effects, and durations of action. Rapid-acting types such as insulin Lispro, Aspart, and Glulisine begin to act in 15 to 30 minutes and produce peak effects in 1 to 3 hours. These effects last 3 to 6.5 hours. Short-acting types, including regular insulin, begin to act in 30 minutes to 1 hour and produce their most significant effects in 1 to 5 hours. These effects last 6 to 10 hours. Intermediate-acting types of insulin, such as isophane insulin suspension, start to act in 1 to 2 hours and exert their maximum effect in 6 to 14 hours. They last 16 to 24 hours. Insulin detamere or levemir begins to act in 0.8 to 2 hours and is non-peaking. Its duration of action is up to 24 hours. Because of these and other differences, the various types of insulin are not interchangeable and cannot be substituted for one another without the prescriber's approval. Once you've obtained the prescribed medication, check the label against the Medication Administration Record, or MAR. Look at the date on the vial to make sure the insulin has not expired. If the medication has been refrigerated, let it come to room temperature before administering it. Inspect the insulin for changes that may indicate a loss of potency, such as clumping, frosting, precipitation, or altered color or clarity. If you're using a correction scale to administer the insulin, obtain a current bedside blood glucose and note the amount to draw up based on the patient's blood glucose. Now select an injection site. In an upper arm, the anterior or lateral aspect of a thigh, the buttocks, or the abdomen, but avoid the 2-inch radius around the umbilicus. When choosing a site, consider the expected absorption rate. Insulin is absorbed fastest from the abdomen, followed by the arms, thighs, and buttocks. Remember to rotate sites. The patient can choose one area, such as the abdomen, and systematically rotate sites within that region. When all those sites are used, you can move to another region, such as the thigh, or he can start the rotation pattern over again in the same region. Draw up the insulin as shown in the video skill preparing injections from a vial, or mix a combination of insulins as shown in the video skill, drawing up more than one type of insulin. Compare the vial and the filled syringe with the MAR. Have another nurse verify that you've drawn up the correct dosage. If you draw up insulin away from the patient's bedside, place a label on the syringe indicating the type and amount of insulin it contains. When teaching patients to use an insulin administration pen, demonstrate how to remove the cap, insert and secure the disposable needle, and then dial the prescribed number of units. Have him demonstrate the insulin injection, as shown in the video skill administering subcutaneous injections. Patients should demonstrate insulin self-administration whenever possible. Discard used supplies, clean up your work area, and perform hand hygiene.